We are the Association of Nigerian Private Medical Practitioners.
Please, can we put our hands together as we take the remark of the SGF? Thank you.
Thank you very much. Good afternoon, dignitaries and also my colleagues that are here. Sincere apologies. I have a scheduled function to attend at 1, and it's very important. It's regarding the COVID-19 surge. As you are aware, the third wave is rising and peaking, and we have to do a lot to protect our country. So sincere apologies for interrupting the program because I have to attend to that meeting. My name is Mukhtah Mohammed. I'm the National Coordinator for the Presidential Steering Committee on COVID-19, and I'm hereby representing the Secretary to the Government of the Federation and Chairman Presidential Steering Committee on COVID-19. The SGF would have wanted to be here, but last night he told me I have to attend because he also has other council issues to attend to. Before I go into the speech and the protocol, let me assure the chairman and members of the AGPMP that your prayers, I have heard them very well, and I'm going to take them to the SGF. As a medical practitioner myself, and I feel free, to speak my mind to my colleagues. Certainly, our healthcare system has a problem. And the solution to the healthcare system in Nigeria, actually the future of the healthcare delivery in Nigeria, is in the private sector. Government cannot continue to take along all the responsibility, and we know that the private sector has a lot to offer, and government will therefore do whatever is necessary to provide the support that will ensure that the private sector, the private medical practitioners, actually play their responsible role. Our profession is a noble profession, and it is beyond what we gain as salaries or to ourselves. As the chairman mentioned, or the president mentioned, our service is to humanity. We're at the expense of ourselves and at the expense of our family. It's like when you have a dedicated father who wants to take care of his children, but he doesn't have the means to do it. He will constantly reassure you that I will do the best for you. Meanwhile, his ability to do that is actually limited. Or when your house is leaking or is about to collapse, and you have the father run away from the house, leaving the household to suffer while he jets out of the country to go and take care of himself. Our profession is beyond that. It is a noble profession, and our service is to humanity. While we are doing that, we also ensure that we take care of ourselves and we take care of our family. So, Chairman, distinguished Senator Ken Namani, a very respectable politician, gentleman, a leader, and a role model for all future politicians in the country. The President of the Association of General and Private Medical Practitioners, Dr. Ike Ode, Executive Governor of Ekiti State, ably represented by my friend, Dr. Banji Filani, the Chairman of the Nigeria Labour Congress, Mr. Ayuba Waba, my older brother who sneaked into this place but was recognized and brought onto the high table, former Honorable Minister of State, Dr. Aliu Idi Hong. Ladies and gentlemen, I'm reading the goodwill message now by the Secretary to the Government of the Federation, Boss Mustafa, on this occasion of the one-day roundtable dialogue on private sector intervention in healthcare. I am deeply delighted to be here with you on this auspicious occasion on the private sector health dialogue and the launching of the 10 billion private sector healthcare intervention project implementation fund. Let me use this opportunity to commend the private medical practitioners of Nigeria and the organized private sector players for organizing this strategic and historic intervention, especially now that the health systems of the world are overstretched. It demonstrates your deep understanding of the challenges of the Nigerian health environment, and your unreserved commitment to the fatherland in supporting government efforts to improve and revitalize the sector. Undoubtedly, Nigerians are found among the best medical practitioners anywhere in the world, and we are proud of you. On behalf of the President of the Federal Republic of Nigeria, President Muhammad Buhari, I wish to also commend you all for your faith in your country, that at a time when many of our colleagues are jetting out to other countries in search of greener pastures, you have decided to stay back to support the entire health system of Nigeria to bring it to the global best practices and standard while encouraging private sector participation. Despite the fact that the private sector doctors operate under unfavorable environmental conditions, such as multiple taxation, exorbitant public utility tariffs, non-subsidized import duties for medical equipment, among others, you have continued to strive and support the health and well-being of Nigerians. These, your efforts, are greatly appreciated by our government. It has also been demonstrated here today with the launch of the 10 billion fund to implement the Save 1 Million Nigeria Mothers Initiative, Mobile Health Solution, and the Awake Nigeria Project, Project 2030. In this same vein, the Office of the Senior Special Assistant to the President on the SDGs decided to respond to the challenge by taking the initiative to construct mother and child centers and strategic partnerships across the country. These initiatives will definitely promote the health of the mothers and children, reduce maternal and child mortality, and of course, help improve Nigeria's poor health indices. Distinguished ladies and gentlemen, I wish to categorically inform you today that Nigeria's health security has been strengthened. With the arrival of COVID-19 and the unprecedented amount of effort and coalition placed by our government to strengthen surveillance, provide more healthcare facilities, particularly strengthen our intensive care units, establish oxygen plants, support more healthcare beds and turnaround for time of testing and detecting other diseases, and further inclusion and involvement of private laboratories in public health response. Despite the impact of COVID-19, we've strengthened and increased market access, facilitation for targeted women and youth in micro, small, and medium enterprises. The federal government social intervention programs have continued to reach out to millions of vulnerable children across Nigeria. Let me re-emphasize the commitment of government towards the formulation and implementation of favorable policies that will be beneficial to the Nigeria's health sector, as I invite you to be part of the Universal Health Coverage 2030, because only an inclusive sector can produce the desired result. At this juncture, I wish to congratulate the private medical practitioners of Nigeria and the organized private sector players on your centenary celebration, and thank you for choosing to use this season to refocus on the state of our healthcare by taking up measures and support government in addressing the challenges of maternal and infant mortality in Nigeria. I have heard the prayers from the President and will convey it to the SGF, and also look forward to the resolutions that will come out of this important workshop to guide government in our policy implementation. I thank you all for listening and wish you a successful celebration. Thank you.
Greatest measure of a nation's wealth is the health of her people.